Retinal vein occlusion, nattokinase as possible treatment. This video looks at the evidence for the use of nattokinase in the prevention or the treatment of retinal vein occlusions. A retinal vein occlusion is a blockage of the blood vessel in the eye. It's like a heart attack in the eye. It can lead to vision impairment or blindness. Nattokinase is an enzyme that was only discovered in 1980. It's a natural blood thinner. So how are retinal vein occlusions prevented or treated? I looked up a medical textbook to learn more. It said there was no proved treatment for this condition. Puzzled, I looked up a respected medical website and got the same answer. Here it mentions fibrinolytic agents as a possible solution. Nattokinase happens to be a natural fibrinolytic agent, something that helps prevent blood clots and dissolve existing ones. Nattokinase is made from a traditional fermented Japanese soy food called natto. It's been part of their staple diet for a millennia. It may be part of the reason why there's such a low incidence of coronary heart disease in Japan. So what's the medical evidence for the use of nattokinase for retinal vein occlusions? Well, a 2006 Californian study found it reduced blood viscosity, and a 2008 Korean study concluded from human trials that it reduces blood pressure. Reducing blood viscosity and blood pressure both help prevent retinal vein occlusions. As to direct evidence for nattokinase in retinal vein occlusions, there is a 1994 report in the Japanese Review of Clinical Ophthalmology. It's entitled, "Natto Diet Was Apparently Effective in a Case of Incipient Central Retinal Vein Occlusion." I'm unable to find this Japanese report online. However, I did find a PDF that talks about it. It describes how taking the food natto cleared the central vein occlusion of the right eye in a 58-year-old man who subsequently recovered his vision. Nattokinase is a supplement that can be bought in stores or online. I looked at a popular and reliable supplement company with an extensive range to see what they have on nattokinase. Of all the different brands they stock, this one has the highest number of reviews. Reviewers from around the world give this brand overwhelmingly high ratings, so it looks reliable. I combed the reviews here, but could find only one mention of its use for retinal vein obstruction. All the other reviews reported favorably instead on its BP lowering effect and improved circulation. If you do decide to test nattokinase, what dose is best for retinal vein occlusions? There's no information here, so let's look at the dosage for lowering high blood pressure, which will also help reduce your risks for a retinal vein occlusion. Looking at the reviews left by those taking this supplement, 2 capsules a day, or 4,000 FUs, is the dose most commonly being reported. FU means fibrinolytic units, by the way. It's how the strength of the nattokinase is measured. Some users take up to 6 or 8 capsules a day, but most find 2 capsules to be the right dose in terms of controlling their blood pressure. One user found only half a capsule a day could be tolerated. My own tests have also shown that 4,000 units or 2 capsules a day is optimal. How did I work this out? I measure my BP every morning and, as an experiment, took varying doses of nattokinase. Here I'm taking 2 capsules about 4 hours before exercising.
Cheers.
I then go jogging in the park, just to circulate the supplement in my bloodstream, and I measure my BP over the next 2 days to see what the effect it has. Here's a graph of my results. I found that 1 capsule didn't lower my BP or control its rise, but 2 did. My BP dropped for a couple of days. Taking 3 capsules didn't do that much more, so taking 2 capsules seems to be about the right minimum dose for benefit. As to its safety, all the books I read said it's safe. One book, however, says it's a safe supplement, but further down also adds it can also increase fibrinogen levels. I only mention this to remind myself the physiological mechanisms involved may not be fully understood. A reliable medical website says not to take nattokinase during pregnancy, after surgery, or with bleeding disorders. Also, there's a solitary report that nattokinase taken with aspirin caused adverse effects in a patient prone to cerebral microbleeds. So it makes sense not to use nattokinase with blood-thinning drugs because of the additive effect. Don't combine nattokinase with Coumadin, warfarin, Plavix, Effient, or other prescribed blood thinners, nor with aspirin or any other herb or medicine that thins the blood or prevents blood clotting. The additive effect may lead to excessive blood thinning. Taking 4,000 FUs of nattokinase, or 2 capsules a day, has been proven to be medically safe. A 2009 Taiwanese study used this dose for 2 months without any adverse effects on patients. Take nattokinase on an empty stomach. Finally, if you think the more conventional drugs are a safer option for retinal vein occlusions, think again. A 2007 study in the American Journal of Ophthalmology reports taking aspirin or warfarin increases the risk of central retinal vein occlusion. Go figure. Remember what I said about mechanisms not being understood? This just illustrates it. I made this video because a friend of mine had a retinal vein occlusion. He thought it was a one-off thing. Then the second attack happened 3 years later, and there was panic, as the third attack could be the one that finally causes blindness. I hope this video helps, especially as conventional medicine doesn't quite have all the answers just yet. For all the resources on nattokinase mentioned here, please click the link below this video. Good luck, and thanks for watching. Please note that I am not a doctor. Please consult your doctor for your medical needs. This video is not medical advice, but only for educational purposes.